Today, we will present the results of the first remote teleguided retinal laser treatments conducted between Europe and North America. The role of telemedicine in ophthalmology has significantly expanded in recent years, particularly in diagnostics. However, only a few studies have confirmed the feasibility of telemedicine treatment. The navigated retina laser enables the separation of treatment planning from treatment execution and allows for real-time remote observation of the laser device screen. This makes it an ideal system for remote retinal laser therapy. In this presentation, we will present the first application of therapeutic teleophthalmology between Europe and North America. Our feasibility study was conducted to assess the safety and efficacy of a teleguided retinal photocoagulation treatment, aiming to facilitate collaboration and education among ophthalmologists of different continents. This represented the first remotely planned treatment for retinal disease between Europe and the US. The two centers involved were the Macular and Genoma Foundation in Rome, Italy, and the Global Retinal Institute with Robin Rose in Scottsdale, Arizona, in collaboration with the University of Rome Tor Vergata. We included one patient from Sudan and one Italian patient affected by high-risk proliferative diabetic retinopathy, both residing in Rome, and one American patient with ischemic central retinal vein occlusion complicated by neovascularization residing in Scottsdale. Ophthalmologists communicated using a separate live audio connection during both planning and treatment. To enable remote planning, the remote ophthalmologist accessed the local laser system and created the treatment plan of the fundus image or overlay diagnostic image using planning software with the permission of the local user. When both experts agreed on the proposed treatment plan, the operator in front of the laser device performed the treatment in accordance with the regulation of the specific country. The success of the treatment was defined by the acceptance and collaboration of the patient, the stability of the remote connection, the completion of the treatment plan, and the clinical outcome of the treatments conducted. In these three videos, the remote specialist creates a treatment plan using a navigated laser located on another continent. He discusses the plan's purpose in real time with the referring colleague while the patient is present. After the treatment plan is accepted, the local ophthalmologist performs all treatment swiftly and accurately. You can edit plan now. Robin, you can do what you want.
So I have applied safety zones over the optic nerve and macula. Those are the yellow crosshatches. Most of our patients are very worried that laser will be applied in the wrong place and they'll lose vision. So this
Our patients are worrying as well.
So our patients are mutually worrying, and this is an advantageous feature to let them know that even if they move their eye, that will not permit the laser to go in the wrong place, and they're very reassured by that. As you see on the photo, there's a reflex. We're using the non-contact treatment system for the periphery. So I'm going to pick the area, and the non-contact will give us a spot size of about 330 microns. We're going to treat away from the macula, which is the far nasal periphery. Is this an agreement area right up here? We're going to go nasal.
So starting from the nasal, moving a little bit to the central and versus temporal, and to end, I would say, at the 11 o'clock position, something like that.
Okay, I think that sounds great. So I've clicked on area, and I'm going to now start in the far periphery.
Exactly.
And I'm going to make it easy for the, I'm going to kind of go in here and go down here. I'm just going to give you an area to treat and stay down here. How many spots is that, Doc?
It's 208 spots, and that could be a reasonable starting point for the patient today for his compliance, I think.
Yep, I think
I find extremely appropriate the treatment that you design.
Are you in agreement with this, Doc?
I'm totally in agreement with that. Now we are ready. The treatment is very smooth. The level of energy is appropriate. We don't want to over-treat the patient. Patient's compliance is fine. Treatment is very smooth. Great.
I'm going to go to confluent spots in this area. Is that okay with you?
It's okay with us. It's the treatment we had to do. Are you going to check the intensity with 5, 6 spots before treating the entire area?
Yes, so I'm going to have you start and
Yeah.
then take a photo.
Correct.
Does that sound reasonable?
It's perfect. We plan to treat exactly that area, not moving forward. Perfect. Can you see the intensity? I wouldn't say more. We can even decrease over 10%. What do you think? We drop down for 260 to 240?
Yes.
Bene, fermo, fermo. Ottimo. Perfetto. Ora un secondo, ci sono rimasti una quindicina di spot, avvocato. Molto bene. Ora fermo pochi secondi. We're done. For patients 1 and 2, all scheduled laser spots were successfully performed, while for patient 3, 2 scheduled spots were not performed due to a joint decision by both parties. All the set objectives were successfully achieved after completing the joint navigated laser sessions. We believe that widespread adoption of this procedure could benefit both patients and ophthalmologists. For patients, the advantage includes the opportunity to receive treatment based on the opinion of the specialist from the reference center or through collaboration between different experts. The remote expert would be able to share his knowledge with colleagues worldwide and provide his expertise to patients he wouldn't otherwise be able to reach. Local ophthalmologists would benefit from being able to perform treatments with the support of an expert in the field. In conclusion, navigated retinal photocoagulation treatment offers a safe and effective option for ophthalmologist collaboration across continents. This methodology allows patients to access specialist expertise globally, reducing costs and increasing patient safety by eliminating the need for travel. It also provides an opportunity for remote local training, benefiting underprivileged countries without specialized resources in retinal laser therapy. Thank you for your attention.